to, sorry.
Zainab Shinkafi-Bagudu, thank you for the opportunity to be able to bring my perspective. I come from Nigeria, a country in West Africa with a population of about 230 million people, which makes it the largest Black nation on earth. I'm one of those children. I'll give you a little bit of my background and then talk about my work. I'm one of those children that was a little bit confused about what she was going to be and do and study. So I ended up dabbling here and there, and I think a little bit of that remains with me. When you were talking, it took me back to a time when I thought I was going to be an infectious disease physician. This is after I had become a doctor, and I actually did a master's in infectious diseases, but I ended up not going that way. I studied pediatrics. I specialized in pediatrics after my basic medicine in Nigeria. And then I went back home and started to interact with mothers. Mostly in our environment, children are brought to the hospital. As we've heard repeatedly, women are the caregivers. So when the children are ill, they come to the hospital and they see me, the pediatrician. But when I sit across, I'm not just a child's doctor to the woman in the middle class parts of Nigeria where I was running my clinics. I am a woman, and any problem that they have, they could share with me. And slowly I discovered that there's a huge gap in women's health, particularly when it comes to their bodies. Yes, we all have malaria, we can treat malaria, but when there are more private things that a woman feels, she has a lump in her breast, she has a foul-smelling discharge, or her periods are not acting the way they're supposed to, they want to talk to another woman. And I started to be burdened with a lot of female issues. In particular, we were also running a diagnostic center, which is another story, but I won't go into that. We started a diagnostic center basically because there was a gap and there were a lot of wrong results that were coming my way after I had practiced in a high-end country, high-income country like the United Kingdom, and I came back to Nigeria, and having clear blood results was a problem. So we started this diagnostic center, and we were able to sort of make things a bit better. One of the solutions that we offered there was a one-stop clinic for women. So they would have the mammograms. We would encourage them to check their breasts and have mammograms, and they find a lump. So they come back to me and say, okay, downstairs I saw that you have a mammogram, and I went and I checked and I have a lump. So that's how I started getting pulled into oncology, cancer, and advocacy in that space. Women were not as educated, they were not aware, they were not able to make decisions, they were not able to access care when it comes to symptoms, the common symptoms and signs of cancer in my environment, the commonest of which was a breast lump, the precursor of breast cancer. Breast cancer remains the commonest cancer in my country. On paper, we're supposed to have about 23,000 women every year, out of which 2/3 die, and they are diagnosed in late stages. So again, gradually, I started being drawn into that world, and that became the career that I have built in the last 20 years. We started the foundation, and the foundation was supporting women with awareness, with screening, and with access to treatment, fundraising. And again, it wasn't enough. So we had to start working with government to improve policies, to work at a higher level, to try to ensure that we have more women-friendly solutions in the government and access to care for these women. Again, that wasn't enough. You go to the government. At one part of my life, I was part of the government. My husband was the governor of one of the states, in the northwest part of Nigeria. And that really opened my eyes to the conflicting issues and the real demand that the government faces. And it's not just enough for us to keep on expecting the government to do this. There's a huge, huge responsibility on government. We have a federation of 36 states, and each state has its own law. But the federal government has their own law, and then the states, it's filtered down to the states, but most of the time they're not able to implement it. We have policies, we have new vaccines coming into the country, but there is no backing research on how we're going to implement and distribute those vaccines. How do we diagnose the women that are probably, you know, they have high risk for cervical cancer when we do not have enough of the machines in the country or within access for the women? So really, that's a lot of what I do now. I work with the Coordinating Minister of Health, Professor Mohamed Pate, as a senior advisor on women's health and cancer advocacy. I also sit on the board of the Union for International Cancer Control, where I was elected the president-elect last year. And this is one of the global bodies that is really keen on translating global initiatives into national action. And through these various platforms, I hope to make a change in women's health, in particular as it has to do with cancer, breast and cervical, which are the two highest occurring ones in my end of the world. Thank you.
Thank you. Thank you, Zainab.